The Democrats' reckless Inflation Reduction Act made swift and very sweeping changes to critical aspects of the Medicare prescription drug program. And frankly, it seriously altered how prescription drugs are made accessible to America's seniors. As these changes are now beginning to take effect, including the Medicare drug price negotiations and the Part D benefit redesign, the negligence and haste of the IRA policies are on full display. In fact, last month, the Wall Street Journal reported on significant reductions in investment in research and development to find the next round of cutting-edge drugs to save lives by the pharmaceutical industry due to the IRA. In fact, in August, CMS published the list of the first 10 drugs selected for the IRA's Medicare price-setting program. The companies affected by the program, which is far from a true negotiation process, have clearly communicated that the IRA price-setting program will limit the ability to discover and develop new and innovative medicines. It will ultimately be average Americans who suffer the most as a result of the IRA and this crushing impact on innovation and investment in research and development. Sick Montanans who once relied on important medical research for a glimmer of hope will now watch in anguish as promising research is abandoned. As if this isn't crippling enough to American access and innovation, CMS also just announced an unexpected demonstration program, which targets the new Part D benefit redesign just as IRA changes go into effect. This demonstration program is smoke and mirrors. Because the IRA changes to Part D, plans are predicting significant increases in seniors' premiums, increases that will go into effect right before the upcoming election. To hide these catastrophic effects, the Biden administration is scrambling and creating a temporary, taxpayer-funded, $73 billion subsidy program to artificially lower premiums so that Democrats can escape the optics and responsibility of raising Medicare premiums on seniors in a critical election year. And I want to thank Ranking Member Crapo for his leadership on this issue and for trying to get answers about this new program. It's disingenuous, it's unconstitutional, and the American people end up footing the bill. All of this is to say nothing of the billions of dollars of enhanced federal subsidies for Obamacare, which were included in the IRA, and those enhancements are set to expire conveniently next year. In short, the IRA was a disastrous piece of legislation, and we are now seeing the damage play out. Milton Friedman famously warned that there is nothing so permanent as a temporary government program. And we're seeing this as exactly the case with the Democrats' plan to make permanent the IRA's temporary increases to the Obamacare premium tax credit. The Congressional Budget Office estimates that making this policy permanent would increase Obamacare spending by $415 billion. Mr. Merkel, you mentioned in your testimony how the enhanced premium tax credit does nothing to actually lower the cost of insurance, nor does it reverse the deteriorating value of ACA plans. Might you elaborate on this dynamic?
Sure. Thank you very much for the question. You know, people stopped purchasing ACA plans with their own money without a government subsidy quite some time ago. Paragon's report, if you read it, you understand why. Premiums are up, networks are narrower, cost sharing is higher, and the IRA just effectively tries to paper over these concerns with more and more money for insurance companies. Unfortunately, it does nothing to resolve the underlying problems and could actually make it worse, because now in some states, roughly half of people don't pay anything for a plan, and that means the insurance company is no longer designing the plan to be of value to the person that's going to buy it. They're just designing a plan to comply with government regulations. I anticipate, as we have already seen since the IRA passed, that plan quality decline, that will likely continue.
I see I'm out of time, Mr. Chairman. Ms. Axon, I've got a question for you, but I'm out of time. Maybe I'll submit a QFR for your response written. Thank you.
Thank you, Senator Daines. Senator Blackburn.
And thank you, Mr. Chairman, and thank you all for being here.